Good morning, everybody. We're going to give it just a moment to allow everybody to come into our Zoom webinar here. Give it about 30 seconds to a minute, and then we'll get started. Thanks for joining us. Awesome. It looks like we have everybody in. So welcome and good morning, everybody, to our first Emerging Conversations webinar series on understanding community needs. This event is part of a new series that the Arvada Chamber of Commerce is offering to ensure we provide ample opportunities for our entire community to understand the issues that will help Arvada continue to be the place we love to live, work, and play. We recognize that we are all a little tired of Zoom at this point after the past few years, but we're so grateful that we have this platform to be able to share these important conversations, create dialogue, and record and share this with a greater audience as it follows. I do want to encourage all of you to utilize that chat function with questions and comments and celebrations. We can still build a community even if we're not together, and we appreciate everyone doing that. I will remind you, even though I know I don't need to because you're always great, but we do want to make sure we keep this a civil conversation and we are positive in how we use that chat function. I also want to remind you and invite you to join our new online network called Mighty Network. We are going to drop in the chat for you a link to join our online community. After today's conversation, we're going to translate some of what we've learned to this platform, and we'd encourage you to join us there where we can continue to have really robust discussions about how we ensure our community thrives. I'd also like to take a moment to thank the many elected officials and dignitaries who've joined us this morning. And as you can imagine, because I can't see you physically, this can be a little tricky. So I'm going to ask that if I don't say your name, if you can just let us know you're here in the chat, I would really appreciate it. We do have Arvada City Council Mayor Mark Williams and City Council Member Lisa Smith with us this morning. Jefferson County Commissioners Andy Kerr, Leslie Dahlkemper, and Tracy Kraft-Tharp. State Senator Rachel Zenzinger, State Representative Brianna Titone, and Fire Board Member Bob Loveridge. Again, if I missed you, please don't hesitate to put your name in the chat. And I love seeing all of you saying hello this morning to each other as well. I think that's awesome. We're glad to have you here. Finally, I'd love to take a moment to thank our sponsors who invest in the Arvada Chamber and make events like this possible. You can see on your screen our key sponsors for the year, our chamber investors. We have many, many incredible businesses that support the work of the chamber, and we're immensely grateful for that. So let's get started. I am excited to introduce Kelly Duncan with Community First Foundation. Community First Foundation has signed on as a partner with us this year in these emerging conversation webinars and our State of series. You'll see on a slide, I think we're going to go back one here, Ryan. I apologize, I messed with the notes here. These are the upcoming events that we are hosting in partnership with Community First Foundation, and we're really excited to have some really critical community discussions as a community in the chamber as we move forward into 2022. So we hope you can join us for this. Today, we are lucky, though, to have Kelly Duncan as our MC of this event. So with that, Kelly, I'll let you take it away. Thank you.
Thank you, Cami, and thank you for all joining us this morning. It is great to virtually see you all, and I'm honored to represent Community First Foundation for this important conversation. Community First Foundation works to make good happen by connecting people, ideas, and nonprofits. And as the community foundation serving Jefferson County, we're devoted to listening and understanding the issues our communities face. So this is incredibly timely and informative for the work that we do. And I just want to take a quick minute to tell you what I mean when I say we serve Jefferson County. We do that in two primary ways. The first is we make grants to nonprofits and Jeffco who are working to ensure that all of Jeffco is thriving. And second, we help donors, whether they're individuals, organizations, or businesses, open charitable giving accounts. They can take many forms: an endowment, a donor advised fund, or even a giving circle of individuals who want to pool their money to make grants to nonprofits. So I'm also really proud that we helped create and continue to run ColoradoGives.org, the online giving platform that we use to to power Colorado Gives Day. And I'm thrilled to serve as your MC today as we dig in to understand the needs within Arvada and how we can come together as a community, individuals, businesses, nonprofits working together in service to our community. So we're going to start today with the keynote presentation and follow with a panel discussion with some truly incredible community leaders that I'm sure you're going to be excited to hear from. So our keynote speaker is Priya Saha. Priya is a consultant ambassador with Kaiser Permanente. She's a trained registered nurse with a master's in public and environmental health. She has over 15 years of healthcare experience. And as a former pediatric hematology oncology RN, she recognizes the importance of living life well and to its fullest potential. She believes in supporting initiatives that encourage the health of her communities and is passionate about health promotion and disease prevention. Priya thrives by kayaking, spending time with her rescue and foster dogs, and exploring mountain towns around Colorado. Welcome, Priya.
Thank you so much for the warm introduction. So as Kelly had mentioned, I am a registered nurse, and I recognized the need to really protect vulnerable populations through really important primary prevention. And some of that happens right here in our communities. We're going to kick this off with a little bit of an interactive pop quiz. So let's get our brains moving. There should be a poll popping up in about a few minutes, and I want you to guess. Cami, do we have the poll? Great. Which of these drivers ranks the highest at 40%? Do we think it's environmental and social factors? Is it personal behaviors, family history and genetics, or medical care? So when we think about all these elements that compile our health, which one is at 40%? So go ahead and answer that poll. Our second question is, which of these drivers ranks second highest at 30%? So just one choice. Is it environmental and social factors, family history and genetics, or medical care? It's super hard, so don't worry if you get this wrong. So don't think too hard on that one, because I will give you the answers. All right, so our poll answers have come through. So a lot of people think that personal behaviors ranks at 40%. So you're correct. So 16 out of 32 of you got the right answer. And the second one, which of these ranks the second highest at 30%? 47% of you said it's family history and genetics. So you're also correct. We've got a very knowledgeable group here. Congratulations, guys. So we're going to go ahead and close that poll. Excellent. So when we think about these little wheelhouses, all of these little pieces contribute to our overall health. And it happens kind of outside the four walls of a medical building. So we're going to go a little bit deeper now into these categories and try to pull apart the environmental and social factors and see how this really influence our overall health. So these are also mini drivers, and they don't function in a vacuum. They all interweave in and out, and they impact each other in our overall health outcomes. So specifically, when we think about economic stability, your income and employment is probably going to allow you to live in a neighborhood that, if you're on the higher end of the employment and income levels, you're going to have a safer community, a lot less crime. There's probably going to be access to early childhood education as well. There might be some access to healthy food options, healthy grocery stores. And then if you're thinking about it on the other end, if you're on the lower end of the income scale, you may not have a lot of access to a lot of these categories. Maybe you don't have safe housing. Maybe transportation requires taking a bus to get to work. Maybe it's not as safe. And all of these factors can contribute to our health outcomes. So we're talking about mortality rates, morbidity rates, your life expectancy, how much you're spending on your health care, your health status, and what those limitations ultimately do for your overall health? So I want to pose this question to all of you as community leaders and business owners. We have two questions to ask ourselves in Arvada. What can we control and what can we influence? Are there things that we can make communities a little bit easier in terms of food access or parks, cleaning up the parks and making it a little bit more safe? Place matters. So when we think about, if you're a business owner and you've got two employees, let's say Matthew lives in neighborhood A, and maybe he's been with you for about 5 years, and Sid is maybe a new employee and he's in neighborhood B. Not every employee of ours is going to have an equal playing field. Maybe Matthew lives in an area that is least deprived. He's got access to a Whole Foods or a Trader Joe's. He's got really good schools nearby. He can go on the bike lanes without trash, and there's access to parks nearby as well. He's going to be in a bracket that his life expectancy is going to be much better overall because his stressors are a lot lower than Sid's. Sid hasn't been there for very long. He hasn't earned the income that Matthew has. Maybe he can't afford the houses that Matthew and his family can afford. So he lives a little bit further away. So Sid is a little bit more deprived. He has a long commute to get to work. Maybe he has a bus transfer. Maybe there's not a King Soopers or any other grocery store nearby. So he has to rely on fast food, which is not going to be very healthy for him overall. There might be crime on his way to work or in his neighborhood. There's probably more violence. People are probably smoking, maybe with poor air quality. We compare these two employees side by side, and we can see that the life expectancy is about a 10-year difference. So Sid may have more chronic stress. He may be prone to more tobacco use, maybe prone to pre-diabetes, missed work days, higher work days, higher compensation costs. So it's really important to see that even though they're working in the same place, and maybe they're making close to the same, Matthew had been there longer. He's making more money and he is in a least deprived area. So we have to see our employees for where they're coming from and their journeys to get to work. Maybe we recognize that Sid is a lot more tired because he's mentally checked out. He's thinking about his family. He's thinking about his kids. Maybe he's part of that sandwich generation where he's taking care of elderly as well. And his presenteeism, his ability to be focused at work, it might be a little bit lower than Matthew's. So this is why the place matters. So how, again, I pose that question, what can we do as community leaders to influence our community? So the neighborhood deprivation index is a sliding scale. So it goes from 1 to 5. So being in an NDI 1 means that you are in the least deprived area. So you have access to education, income levels are high, poverty levels are low. There's a lot of employed people, then housing is safe as well. So NDI on the scale of 5, a lot of these factors are a lot. It's a little bit harder for individuals. There's a lot more unmet social needs. So we're going to take a close look at the NDI for Arvada. So let's go ahead to the next slide. Great. And so when we look at the colors here, the dark green is going to show us the NDI levels. So it's going to be NDIs 2 and 1. And a little bit of 3 here in Arvada, which is really good. When we start to see the blacks, we start to see the black color is when we start to see a little bit more of the deprived areas. So Arvada is actually in a really great place in terms of social needs when we're looking at neighborhood deprivation indexes. So now we're going to zoom in a little bit closer into specific zip codes. And if you are a business owner and you work with Kaiser Permanente, I would be happy to provide further detail about these NDIs for your specific company so you can really see where these employees are coming from, how far they're traveling from. Maybe they have a longer commute and they're in a different zip code. However, the zip codes here in Arvada are levels 1 to 3. So it doesn't mean that if you're in a level 1, you don't have unmet social needs. It just means you're on lower end of the scale. And it's also important to note that these median household incomes may be covering 4 or 5 people and may be covering elderly parents as well. So just because you're in that higher household income range, it doesn't mean that were also just having unmet needs. And I'll explain that a little bit more. So pre-pandemic, this data is really interesting. 1 in 4 Americans had unmet social needs, and that got astronomically higher post-pandemic. So if we're just thinking pre-pandemic and how high these numbers are, we can only imagine how high the numbers are now. And we're still kind of working through that data because we're actively in this pandemic. So 1/3 of all Americans pre-pandemic were experiencing stress related to social needs. What does that mean? They didn't have enough funds to do the day-to-day things that they needed. Maybe they couldn't afford to see a doctor. Maybe they couldn't afford to pay for daycare and rent. So things were a little bit trickier. 17% lacked transportation and 9% lacked housing. So it's also very important to recognize that while Arvada is in that 1 to 3, you can still be struggling with your unmet social needs. This is a study that Kaiser had done about unmet needs. So those who had sometimes rarely answered, sometimes rarely or never. So the questions included talking about your housing. So how often is there violence in the home? Is the neighborhood safe? Is there access to fresh food and vegetables? You can see here with the bracket, those making over $100,000, it's that dark brown maroon color. There's still a lot of unmet social needs. When we look at the relationships, are there neighbors or friends who you can rely on if you are in a bind, maybe to pick up your kids or to drive you somewhere? That number is still alarmingly high. 27% had unmet social needs in terms of relationships. So what does that mean? How can we lean in and help out one another here? Under 50,000, obviously, this is going to be a lot higher. When we think about how much income you have, it's expendable. You can lean into those resources. You can pay for daycare. You can pay for transportation. You can pay for a lot of things. However, those unmet social needs don't just affect those under 50,000. It affects those all across the board. In terms of, I apologize. When we think about the housing crisis has been really tough this year for a lot of people. Homelessness has affected people all across the board, even though that could be a higher income bracket that you're in. What does the debt look like? What kind of colleges did you go to? Maybe you had to take out a bigger loan for school or your kids' schools. So there's a lot that we're not seeing when we just look at regular data of diabetes rates and high cholesterol. What's happening underneath is happening in the community. So these are little things that we maybe can control. So when we think about the lifestyle impacts, if I'm stressed out, if I don't have access to fresh fruits and vegetables, I may be more inclined to be smoking. Smoking can calm you down. It's super addicting. It costs a lot. And the medical cost related to smoking is $5,816 annually. So it's a direct medical cost per employee. Additionally, maybe my blood pressure is going to go up because I don't have access to fresh fruits and vegetables. I'm going to go and get really greasy burgers on my way home because I'm stressed out, don't have time to cook. My blood pressure is going to shoot through the roof. That's another added direct cost. And probably comfort eating because I maybe can't afford the heat this month. So maybe over time, I'm going to be in that pre-diabetic or diabetic category, and diabetes costs a fortune, $4,413 annually per employee. So social needs, what are the impacts on the health? So if we have low income adults, we're not going to have a whole lot of access to all the things we mentioned before: food, housing, transportation. What are some things that we can do? SNAP benefits. The introduction of SNAP had brought down healthcare costs by $1,400, and that's per person per year. So asthmatic adults as well, that could be like mold in the house, infestations, things like that. What kind of interventions can we do as a community to provide healthy, safe homes? When we start putting these interventions in place, we see the cost savings. So we see a 91% drop from emergency department visits and hospital admissions as well. When we think about the diabetics, we can perhaps do a transportation program and offer transportation for patients to get to the hospital or to a doctor's appointment. Checking up on those A1Cs, it's super important that the A1Cs are being monitored. That's a $927 savings per patient as well by offering certain interventions that help our communities thrive. So in Arvada, what can we do to help control this? What can we influence here to help the individuals in our community? We've got positive influences, we've got negative influences. We know that parks and open spaces can provide community, it can provide relationships. It's a great place to connect and meet. If I don't have a safe place to take my kids, maybe I'm staying home. Maybe there's too much crime outside. What does the opposite side of that look like? It's safe, walkable streets. If I don't have grocery stores, it's the fast food. If I don't have good schools nearby, maybe my kids don't have a chance of going on to college afterwards, or vocational school or anything like that. If there's not clean air, maybe we're staying inside and maybe my house isn't that safe. There's a lot of things that we can see from the positive side and the negative. So when we focus on the positive, are there little low-hanging fruits here, things that we can do day to day that is ultimately going to help our community thrive? And feel free to use the chat function here and drop in some ideas that you have as well. When we look at the crime rates, it's actually looking pretty good. So the most dangerous areas are going to be the dark blue, and the more safer areas are going to be the lavender and lilac colors here. And, there's no surprise, higher income, lower crime. They're all related, interrelated with each other. Lower crime also is going to allow for better schools. So we zoom in here, the best schools are going to be the dark purple. We see it's kind of out towards Broomfield, and then towards Wheat Ridge and a little bit near Berkeley, the schools get a little bit less safe. And we see this from the NDI map. All of this is pulled from census data, and I'd be happy to share more of this with you as well if you are interested in going a little bit deeper into specific zip codes and communities. And Arvada here is, again, looking really great with the NDI index. It's around 1 to 3, as we have seen before. So now I want to dig a little bit deeper into what Kaiser is doing in terms of our mission and our work. We have a lot of programs in place because we saw the data wasn't looking great. So we decided to lean in a little bit more for our members and our communities. So we have programs such as safe housing, thriving schools, which really helps teachers understand resilience and fostering resilience within their students. There's charity care, Medicaid, economic opportunity, city health, and environmental stewardship. And Kristen Turnbull is going to give us a little bit more in-depth information about Unite Colorado. So I'm going to pass it over to you.
Just gonna make sure I can get on video here. Hi, I'm Kristen Turnbull. I did want to jump in on this section. I am a community engagement lead for Kaiser Permanente. And yes, some of the things that we look at when we do this, sorry, is understanding that total health is not going to happen within the 4 walls of a medical building. We saw that actual acute care is about 10% of your care outcomes. And so all of these programs are things that we actually do in Colorado. And we focus all of our efforts using this NDI data. So what neighborhoods are most at risk and how can we influence change there? One of the most recent things that we did is we came in as a founding funder with a program called Unite Colorado, which is a social services, I'm going to call it referral network. And what we've done is we've made it available for all nonprofits to sign up and use this program for free. But essentially anyone that they are serving with an unmet need, say it's a food bank, but they talk to somebody at the food bank that also needs access to housing. They can search within Unite Colorado to find local organizations that support housing needs. And then they can make a referral for that person directly within the system. So we're really excited about it. It just kicked off. Basically all of last year was bringing on new nonprofits. There's over 300 across the Front Range in Colorado currently participating. And we'd love to share this with you if it's something that anyone is interested in. And then I did want to bring up one of the other places that we are working on is economic opportunity. And this is a newer space for us to look into. But we have a couple different programs available. We are working with an organization called Inner City Capital Connections to provide free executive coaching and financial coaching to small business owners that have employees within some of the lowest resource neighborhoods, or employers in business organizations that are minority owned, women owned, veteran owned, and usually struggle with access to financial capital. And that's a free program that we offer. And I believe we're going to have a new cohort running in June, free for everyone. And then we also have a partnership now with an organization called Change Machine that offers free financial coaching tools to organizations that work with individuals on those things. And we would also love to be able to offer you those tools and resources as well. And as always, if anybody ever has questions on some of the different programs and resources we are doing in any of these spaces, please always reach out. And I'll put my contact information into the chat. With that, I'll hand it back over.
Great. Thank you so much, Kristen, for bringing us home. And if you have any questions, feel free to drop them in the chat. There was a lot of information we presented today. Hopefully it was interesting. Hopefully it was compelling and it shared a story, and hopefully it motivated you a little bit to kind of look at employees with a little bit more empathy, to see that not all of us are coming from the same place. We're all kind of struggling in different ways through the pandemic, but maybe people are struggling a little bit more or a little bit less. So hopefully we got to help you see your community through a little bit of a different lens. Overall, Arvada is doing really great, and we're proud of that. So keep up the great work, and we continue to share thought leadership with you, and we're interested to hear about what you can influence. So I'm excited for ideas to come and to continue to thrive in this community. So thank you so much, and I'll pass it back over to you, Cami. Thank you, or Kelly rather.
Thank you, Priya, and thank you, Kristen. That was an incredibly robust overview with really compelling information, and I'm walking away just with a greater understanding of how our health outcomes are influenced by so much more than just healthcare services. And that place really does matter, and how lucky we are to live in a place and work in a place like Arvada where we're doing really well, but we can't take that for granted. And we know, even looking at the data based on the zip code, some of our neighbors are in neighborhoods that aren't doing quite as well. So what does that mean together as a chamber, as a community? What can we do to really promote those resiliency factors, to promote the great activities that are going on in those communities, to make them an even stronger and more connected place for our neighbors? So really great information, very grateful for that. And now we're excited about the panel we pulled together for you today to help us start thinking about and discussing what the data we just heard means for Arvada and the resources that we're going to need to ensure a quality community. So it's my pleasure to welcome Mark Deven, Arvada City Manager, Link Strate, the Arvada Police Chief, and Mike Piper, the Arvada Fire Chief. Welcome, gentlemen. We're thrilled to have you. And we're going to jump right in. So we have a handful of questions that we'd like to ask you in reflection to the presentation that we just heard. And I know we could talk for length about each of these. So I hope that this is really just the start of a community-wide conversation that we can use to continue to ensure that Arvada is thriving. So I'm going to start with the first question, and I'm going to go in this order. I'm going to ask Mark to answer first, then Link, then Mike. So we heard Priya share details on how social drivers impact health. So things like our social connectedness to our neighbors, how we're doing economically, whether we live near parks. And I would love to know from your perspective, why is this conversation important for us to be having right now? Mark, we'll start with you.
Thank you, Kelly. It's a great question. And what I would offer is that we have to, as a local government, we have to continue to invest in the conditions that created attractiveness within Arvada. So our neighborhood parks are something, for example, that we're very proud of. We have virtually, I think somewhere over 90% of our population is within about a 10-minute walking distance to a neighborhood park. So that is, actually on the high side of the national average throughout the country. We're very proud of that. We need to continue to reinvest in our trails and open space systems, because we saw how that has a positive impact. And then the other thing that I would add is that we need to continue to invest in social connections and neighborhood resilience. We just saw the devastating impacts of a tragedy that occurred in the neighborhoods to the north of us. We need to invest in discussions and conversations and improvements that we can work with our public safety partners on, in terms of making our neighborhoods and communities more resilient.
Thank you, Mark. Link, you're up.
From the police department's perspective, we certainly understand our role in community and the understanding that those that live and work and play here want to do so and feel safe in that engagement. We also understand the importance to our businesses to feel that they can draw people, attract people to Arvada, and that they feel safe visiting Arvada and spending their dollars here. As the police department, we have a strategy that we are a sector-based department. And what that means is we have divided our department in 4 different locations. We operate out of 4 different facilities. And the reason for that is we wanted to be connected to the community. We didn't want to look at the city as a whole and try to understand the problems of the entire city. When you break it down into smaller pieces, you start to see smaller issues come to light for the police department. And we're not only involved in the criminal response, we also want to make sure that we're addressing quality of life issues. We want people to be part of those smaller communities and understand their neighbors, their parks, their business communities. And we wanted to insert ourselves in that. And in those sectors, we have sector commanders, and those commanders are responsible for that sector. And in that, they understand what the traffic patterns and concerns are, certainly what the crime patterns and concerns are. And then again, those quality of life issues. Those sectors are open to our community. We call those our community stations, and that was a purposeful statement as we said that. And the heart of each of those community stations is our community room. And any community member can reserve that room and use that for their meetings. We've had birthday parties, and it allows the community and the police department to engage and interact in ways that we might not otherwise have the opportunity to.
Great, thank you, Link. Mike, we'd love to hear from your perspective as the fire chief, why this conversation is important now.
Good morning. Thank you for having me, and thank you for this platform to discuss these important issues. I think it's important to be having this conversation because addressing social drivers saves lives, and that's what our mission is. These drivers also affect our health, as Priya mentioned. They affect our health as individuals, and as such, it affects our health as a community. These drivers, they drive overuse of the 911 system. And as EMS providers or emergency medical service providers, we see these things every day. And we're in a unique position to help connect people with the resources to help them.
Thank you, Mike. This has been great for me. I knew great things were going on with the city, and learning even more about what we're doing to really promote our neighborhoods and to connect our neighbors. So the next question, and we'll go in a different order this time. We're going to start with Link, go to Mike, and then Mark. Your next question is, data is a helpful tool in understanding trends within our community. But we know that lived experience is also critical to understand what's really going on. Based on the experiences of you and your teams, what can you share about how people in Arvada are being impacted by the social drivers and the consequences that how it affects them personally?
Well, you said a lot of different things there that are near and dear to my heart as working in the police department, and that's data. We use data to understand how we deploy our resources and to make the greatest impact we have in our community. You also talked about some of the social drivers. So ideally, what we would like to do is we would like to listen to our community, get a sense of what their concerns and issues and problems are. And we could speak to the homeless issue and the rise of the demand on first responders as it relates to those that are experiencing homelessness. And so we want to take the message that we've heard from the community, and then we want to look at our data, and we want to see the commonality. Is the data representative of what we're hearing? And in this case, as we relate to the homeless issue in our community, it absolutely is. We hear a larger voice from our community. We hear a larger outcry about the concerns and issue with homelessness, and the data is supporting that. To give you a really quick sense of that, in 2017, the police department would respond to approximately 50 calls as it related to homeless and transient in the course of a month. Over the last year, we have seen where we are responding to up to 400 calls of service as it relates to homelessness in the course of a month. You can imagine the impact that has on our resources and the need to go out there and provide services across our city. When people speak about homelessness, and I'll leave it here real quick, is that we tend to have a very narrow view of that, and that's the visible homeless that we see in our community. Those that are chronically homeless, oftentimes individual males, but there's a female group there too. But there is a much broader sense as we talk about. We have families that are in crisis. We have those that are about to enter homelessness. We have those that are in gap. We have those that may have a place to live, but they don't have the appropriate food. They don't have access to transportation. And so those are the oftentimes forgotten homeless that we can probably have a greater impact on.
Thank you. I think it just speaks to how multidimensional our living situation and thriving situation is, and how much we need the nonprofit. So knowing that we have partners like Kaiser who provide Unite Colorado to help connect people to all the resources they need is really, really helpful. All right, Mike, you are up to talk about how you use both data and that lived experience to focus your efforts.
Here at the fire department, we collect data on a lot of different things, emergency response times, call processing times, a variety of things. But I had an interesting experience years ago. I was driving northbound on Wadsworth, just above Clear Creek, and our dispatch center had toned a smoke investigation, and I could see the smoke coming from beneath the bridge. So I stopped. I was on duty, and there was a ladder there for access, presumably for CDOT or somebody like that. And I climbed down that ladder, and I was just astounded by what I saw. There was an enormous homeless population underneath Wadsworth at Clear Creek, and none of the data that I had received or as a department that we were collecting and analyzing told me that we had that homeless population in our community, and the smoke was coming from one of them, cooking outside of their tent. But it was an interesting experience, and I went to the fire station and talked with the firefighters, and they were like, "Of course, you don't know about that. This is the first you've heard or seen of that." But it's a good example of how important it really is to be engaged and out in the community and seeing things with your own eyes, because as valuable as data is, and it's certainly valuable, it doesn't tell us the whole story. And so what are the consequences, obviously, of this homeless problem? To piggyback on what Chief Strate said, there's consequences. There's an image in our community. There's impacts on local businesses and the economy. The homeless problem impacts the 911 system and the healthcare system, because people who don't have access to healthcare sometimes use the 911 system. And obviously, the population is very vulnerable to crime. And as Chief Strate mentioned, it impacts crime as well.
Thank you. That was a great example of matching the lived experience with data. Appreciate you sharing. Mark, you're up.
Yes, thank you, Kelly. So making a statement after these two chiefs talk, I'll be brief because they've really hit the high notes here. But what I would add is that we saw some good indicators in the presentation from Priya of pretty much how well we're doing here in Arvada, and I would agree with that. However, I would also add this: Arvadans are used to a high quality of life. That's been the hallmark of this community for many, many years. So as we deal with issues such as homelessness and the visibility of homelessness, and then also some of the social connections that were lost during the pandemic, I think we're hearing a lot from our community about a lot of concerns and maybe some anxiety around what the future holds. So I think we have to be prepared for dealing with that and for taking action to address some of those concerns. Despite whatever positive data we may see, there's still lived experiences, particularly that might compare to what has been in place in the past, that we have to realize the need to continue to do whatever we can to improve.
Thank you, Mark. All right, on to our third question. And this time, Mike, you get to go first, followed by Mark and then Link. So have you witnessed the implementation of protective factors and resilience within our community when people are faced with challenging circumstances? And if you could share some of the success stories you've witnessed of families, communities, businesses coming together, that would be fantastic. Mike, you're up.
Well, thank you, Kelly, for throwing me such a softball. This is a terrific question. And we have, the best example that I can think of is COVID, right? Businesses and specifically restaurants adapted by providing outdoor dining. And government, we had to collaborate to enable that in a safe manner and in accordance with the fire codes and other building codes and ordinances that keep people safe. Civilians patronized local restaurants and businesses. Local restaurants and businesses patronized each other. It was an amazing thing to see. And from the fire department's perspective, we almost ran out of N95 masks. In fact, we had an order of personal protective equipment that was seized by the Taiwanese government, and I don't fault them. Our PPE was in Taiwan and they wanted it to stay there. But a local big box here in Arvada provided the fire department with their entire inventory of N95 masks. Obviously, it's a big problem for a community when healthcare providers like the fire department, if we get sick and we go out into the households of people and we make them sick, we have a huge problem in our community. So again, I think COVID was probably the best example I've seen in my career of resilience and people working together toward public safety and the common welfare of the community.
Thank you, Mike. Mark, would love your examples.
Well, this is a softball. The Arvada Resiliency Task Force that we work together, the Chamber, the city, the Arvada Economic Development Association, the business community, we came together almost instantly in March of 2020 in order to work with our business community primarily, provide them with the kinds of assistance that they needed, personal protective equipment, some grants we were able to funnel through the CARES Act, information around how to deal with COVID. And then ultimately, one of the outstanding decisions that we worked together, and I would include the police department and the fire department, as well as the chamber and others, was the closure of the streets in Old Town, which was made almost instantaneously and happened almost overnight, and now led to what we call a semi-permanent closure as we look at possibly making it into a pedestrian mall. But this community came together almost instantaneously when the pandemic hit, and it was because of great relationships and great people working together. So I'm very proud of that. Very proud of my community partners, the chamber and all these everyone else, the city council. I'm blessed to work with a city council that said, just go, just get it done. And we did, and we had their support. We had the support of the community.
That's a great example. Thank you, Mark. And I got to give a shout out to the Arvada Chamber team, because they were instrumental in pulling all of that together. And I think just them hosting this conversation, what they did with the Resiliency Task Force, just speaks volumes to the way they help our communities thrive. All right, Chief Strate, you're next.
Well, great examples by Chief Piper and Mr. Deven. And so I'm going to give you a reply that kind of speaks to historically how Arvada has done in this, because this isn't something that we are new at. Arvada has a long history of trying to find ways to connect and be resilient as a community. And so I'm going to speak to Ralston House. I am myself and Mr. Deven are on the board of the Ralston House, and that is an advocacy center that was started here in Arvada that has expanded to serve the entirety of Jefferson County and now in Adams County. And that is for our most vulnerable victims, and those are our kids. And instead of bringing them into a police department, we bring them into a home where they can sit and they can tell their story of being victimized. And they have forensic examiners that understand exactly the need to and why it's important to talk to kids in the way that they do. We also have Porch Light, which serves families that may be in need as relates to domestic violence or other crimes. And it gives them one place to go and try, instead of sending them all over the county to seek services and or justice through that system. Here in Arvada, we have co-responders that respond to those in crisis and mental health. We have a partnership with the fire department. We are trying to find alternatives to actually address those that are in crisis. And we have a homeless navigator that serves the city, and the police department has 4 officers, core officers, that respond solely to those that are in need. Now, those calls for service are beyond what they can handle, but they are there to focus on those that are finding themselves homeless. So yes, we do. But I also want to say that we're not a Johnny come lately. That has been a culture of this community and the larger Jefferson County community for decades.
Thank you. I think those are terrific examples, and it leaves me feeling very heartened that when we have problems, we have great resources and great connections in place upon which to draw to help solve some of those problems together as a community. So really appreciate those examples. So I have 2 more questions. The next one, Mark, you get to go first on this one. Can you share with us one programmatic response that's being implemented in Arvada to support community needs?
Well, Chief Strate just mentioned homelessness, and we are right now working on a collaborative program between all the local governments in Jefferson County to implement a regional homeless response. This was something that was discussed. Actually, the origins of the discussion occurred in October of 2015, when the elected officials of Jefferson County came together and identified homelessness at that time as something that was a critical need, and directed their managers and others to get engaged and involved in terms of how to respond to it. And we have continued to do that. Link talked about the resources that are being implemented within our community, but what we're also doing is coming together as a regional group of governments within Jefferson County to establish a more countywide response. That includes establishing navigation centers and other forms of collaborative assistance in order to provide a uniform and a repeatable and sustainable response to homelessness. So we have a great history of doing that in Jefferson County, and we will continue to do that. And I would offer that as a good example of how we're working together.
Wonderful. Thank you. Link, you are up next.
Well, I'll stay on this theme and give you a little bit more information about our core officers. And these are our sworn Arvada officers. We started out with 2, and that has expanded to 4. And these officers are there to serve those that homeless community, those that are finding themselves in need. We often find that there is a correlation to mental health and substance abuse with this community also. And I would say it this way: these officers aren't out there just to look for enforcement strategies, although that is a strategy at times, and it's an appropriate strategy. But they're also trying to make sure that these individuals are plugged into and have access to the resources they may need, whether that's counseling, substance abuse counseling, mental health support, or what have you. Try to get them into housing or whatever their needs are, employment. And I think what is telling at times is this community that these officers serve will oftentimes look at them as their only friend, or the first responders that go out there, and they will speak to them as their friend. And those are the only people that actually understand, that know, that see where I live, and will actually spend the time to engage and talk to me.
Thank you. Mike.
A neat program in our community is called Dave's Locker. We had a firefighter named Dave about 5 years ago that needed hip surgery. And after hip surgery, he needed a variety of mobility devices and other devices to help him use the shower and the restroom and so forth. And through the course of his physical therapy, he came across a lot of people that didn't have access to mobility devices. Either their insurance company didn't provide them or they couldn't afford them. And then he noticed that when he was done with his devices and he tried to turn them back in, the insurance company said they didn't want them, just keep them. And so through the course of that, we became aware that there's an abundance of mobility devices stored in people's garages and in their attics or that are ending up in the landfill. And then there's an abundance of people in the community who don't have access to those devices who need them, such as wheelchairs and walkers and canes and even hospital beds. So now this program connects people who need mobility devices with those who have a surplus of mobility devices, and it's housed out of our headquarters here at 7903 Allison Way, and it's all free. It's completely staffed by volunteers from within the community and funded by donations, but it's free to access mobility devices. And we keep those devices out of the landfills and in people's homes and hands where they belong.
Such great examples. Thank you, all three of you. So I think this question is primarily for Chief Strate. In from one of our audience members, what is the interagency cooperation with the I-70 Kipling corridor? Does Arvada Police Department and Wheat Ridge Police Department overlap work, or is the boundary I-70? One more part, and does the Arvada Fire Department, so Mike, we're pulling you in too, handle all calls since Wheat Ridge doesn't have a fire department?
Great question. And the boundaries, and Chief Piper can speak to that, are a little different for the police department and the fire department, as the fire department is a district. But Arvada boundary ends north of I-70 on Kipling. And I'm assuming that they're talking about some of the issues along those hotels, I-70 frontage road, and then certainly right at I-70 in Kipling. That is in the city of Westminster, or I'm sorry, Wheat Ridge. We do work with them. We do partner with them. We are limited. We can't send our Arvada police officers down there and deal with that specifically in the city of Wheat Ridge, though we do deal with the, I guess, overflow into our city, which would be just north of that. The Target shopping center is in the city of Arvada, and then you're seeing some of those, the residential areas just north of that are in the city of Arvada. So we do deal with that, but we cannot go down to I-70 and Kipling and enforce there, if that was specifically the question.
Thank you. Mike, did you want to add anything? It's okay if you don't, but I want to give you a chance.
Sure. We are not, we're a special district, the Arvada Fire Department. We're not a section or a division of the Arvada city government. And our jurisdiction extends south to Clear Creek. So we provide fire protection and emergency medical services to about a third of Wheat Ridge, the north third of Wheat Ridge. And then south of Clear Creek is West Metro Fire Rescue, who provides fire protection to the other 2/3 of Wheat Ridge and to Lakewood and some other regions. There is some overlap, though. We have an automatic aid agreement, and we send to fires. We send the closest resources, regardless of whether they're from our fire department or West Metros, to deliver the most prompt service that we can to that section of the community.
Thank you. All right, I think depending on time, we'll see how long this one takes, but this could be our final question. And we will start with Link, go to Mike, and then Mark. If you had to pick one community challenge for us to put collective resources toward, what would it be? And is there a particular role the business community can play?
That is easy, and we'll stick with the theme, and that is homelessness. And first, it's a better understanding of truly the impact of homelessness beyond the visible homeless. As far as the business community is concerned, I get that they are frustrated and concerned with the impact that this homeless community may have on their ability to do business, and that those that want to come down, and let's just use the Old Town area, and shop and eat and go to the library, may hesitate because of what they're experiencing and what they're encountering in the Old Town area. So if we could have a coordinated effort to understand what happened in Old Town, what what drew those individuals to that area? Are those, where are they from? How can we best serve them? And then how can we move on as a community? I think that if we could have a clear understanding of some of those questions and then a strategy to move forward to deal with that, I think that would serve us as a whole, as our community, and certainly the business community.
Thank you. Mike.
I have a very similar answer. I think behavioral health emergencies is a real epidemic in our community and in most communities like ours. In the case of the fire department, if we put together the types of calls that are suicides, suicide attempts, substance use problems, all those types of incidents are our second leading call type, second only to fall victims. So we're collaborating with the city, and we're collaborating with the Jefferson Center for Mental Health and with the Arvada Police Department. But this is a real challenge for our community. And I would say that, the way that businesses could support us is by doing what they're already doing. Sometimes in government, our revenue streams are under attack. It's important for government, I think, to be cognizant of the impact of taxes on businesses and on citizens. But I think it's also important as businesses and citizens to be cognizant of the impact that reducing revenue streams from government can have. And so our ability to expand and provide more services meeting the needs of the modern community is contingent on our revenue streams being maintained.
Thank you. All right, Mark.
Well, my answer is going to align very closely with Link's answer. In addition, what I would really ask of the business community is to become engaged with the solution. I think there's a lot of engagement around the impacts and the need to address it. But I think becoming engaged with the solution, becoming more understanding of the issues and impacts of what we're dealing with, and how we need to resolve it. We have to resolve it in a way that respects civil liberties and rights, as well as addresses the negative impacts and allows us to deal with people and put them in jail if that's what's necessary. So I think becoming engaged in how the solution needs to be implemented is probably the biggest ask I would have of the business community. And I think forums like this certainly help.
Thank you. So I'm walking away with things that we can do are to better understand the problem, what caused the problem, especially in Old Town around those who are unhoused, and then really thinking holistically about the solution and understanding what's possible, what isn't possible, what may be short-term, what may be long-term, so that we can collectively solve the problem. And thank you to Lisa Smith. We're going to end on a light note. So this should be a one-word answer. And Mike, you get to go first. If the fire department and the police department were to compete in a pickleball competition, who would win?
That's a bigger softball than the last one. The fire department, of course.
All right. I'm going to let Link go next, and then Mark will be the decider, because I have a feeling I know what Link's going to say.
Have you seen some of the guys that work for me, Mike?
All right, Mark, you get to decide who's going to win.
Well, I'm a hometown guy, so I'm going to go with the police department.
All right. Thank you all very much. What a great morning we just experienced together. I want to thank all of our speakers, Mark Deven, Link Strate, Mike Piper, who not only, and of course, Priya and Kristen, and the information they provided from Kaiser Permanente, not just the data, but also some of those resources that we as a community can take advantage of. So we learned something new about our community, but hopefully it inspired us to act. We got some great specific information about what we can do to work with Mark, with Link, with Mike to address some of the problems, especially as they relate to homelessness. So there's power in being here today, and there's power in the word together. These 8 little letters tell a story about community and what we can accomplish when we work arm in arm. So our request is let's continue the conversation started today. And let's remember that together, we can make good happen in Arvada and in the larger community. So thank you all for joining us for this community conversation. I wish you all a wonderful Friday and a great weekend.